have to stand like this?
Recording in progress.
Good morning and good evening, good afternoon, everyone. Welcome to the East African Biodesign Fellowship Graduation Ceremony. My name is Natnal Shimalash. I head the East African Biodesign Program at the University of Global Health Equity in Rwanda, and I have the pleasure of being your Master of Ceremony for this event. I've had the pleasure of working with this group of fellows for the past 10 months, and I am proud to be here celebrating their hard work and achievement. Without further ado, I would like to now invite our Vice Chancellor, Professor Philip Cotton, to open this event for us.
Thank you, Natnal. Good evening, good afternoon, good morning, everybody. Thank you so much for being with us. Special welcome to Basil, Salsawit, Maureen and Bertrand, of course. It's an immense privilege to be here today to celebrate the extraordinary journey of 4 people in the East Africa Biodesign Fellowship. This program, I think, exemplifies the power of innovation when it is channeled towards addressing the urgent healthcare needs tailored to the African context. Your innovations have come at the right time and where they're most needed. For example, while countries in North America and Europe have over 95% electronic health records adoption in healthcare facilities, Africa's rate is lower than 25%. This shows how Africa is looking to you to innovate. The fellowship is not just about developing solutions, it's about fostering a deeper understanding of the unmet needs in East Africa and equipping bright minds to address those needs with precision and I think also with empathy. Through this fellowship, we're not only building new healthcare solutions, but also creating a new generation of leaders who will champion equitable access to healthcare across our continent. I was particularly delighted quite recently going to a meeting with a Chinese delegation to the University of Rwanda to find our fellows, the people I call our fellows, working in the UR labs. It's a beautiful coming together of several organizations, and I thank you for that. Your journey over the last 10 months has been filled with learning, collaboration, and innovation, and it's a testament, I think, to your resilience and passion for improving lives. You've embraced the biodesign process and through it have created pathways for impactful change. Today, as you receive your certificates, remember that the solutions you develop will touch lives and ultimately drive the vision of healthier communities. You've had the immense pleasure of practicing from a country that serves as a benchmark to many in improving lives digitally. Innovations like drones for blood delivery by zipline the Internet of Things, broadening telemedicine access supported by 98% of mobile network coverage, have positioned Rwanda among leaders in digital health in the African continent. These have been driven by Rwanda's e-health strategic plan, which seeks to improve healthcare delivery through digitization. In all of our thanks today, we give thanks to this beautiful nation of Rwanda for the work that it does, and we thank you for being a part of that. What you've done emphasizes, and what the Rwandan government is doing in health, emphasizes public-private partnerships, which are key to executing programs like this. Our late founder at UGHE, Paul Farmer, said, "With rare exceptions, all of your most important achievements on this planet will come from working with others." Thank you. From this, I wish to conclude by issuing a token of thanks to our dearest partners, Stanford University, the University of Rwanda, Kenyatta University, and the generous support of the Gates Foundation. We deeply value your support. With that, I say thank you, and I'm pleased to open this ceremony, and I congratulate you. Thank you. Natnel.
Thank you, Professor Cotton. Over the last 10 months, our fellows have been on a roller coaster ride, from identifying unmet healthcare needs to developing solutions and occasionally questioning their life choices. Now, please allow me to welcome one of our graduating fellows, Basil Masabo, to share this journey with us.
Ladies and gentlemen, distinguished guests, mentors, colleagues, fellows, family, friends, secret admirers, good morning, good afternoon, good evening. My name is Basil Masabo, one of the East Africa Biodesign Fellows. We are honored to have you join our auspicious occasion today as we celebrate and mark the end of one phase of our journey and the beginning of another, more equally, more interesting and more challenging phase. It has been an exhilarating experience, a thrilling roller coaster, and if I would dare say, we have had the time of our lives. But most important of all, we have learned. We have had eye-opening encounters and life-changing adventures. And as we stand on the precipice of a new and next big thing, we look back with gratitude and admiration for the far we have come. It reminds me of a Swahili saying that says, "Lililo na mwanzo, lina mwisho." A literal translation is, that which has a beginning has an ending. I remember it just like yesterday when we landed here in Rwanda. 4 strangers from 4 different countries with 4 different and unique backgrounds from different cultures who are meeting for the very first time, but all driven by one common desire: to innovate a difference in Africa. And 10 months down the line, these strangers have become like family. They have become a formidable team and an irresistible force working towards health equity and better health care for underserved communities. Now, we may be tempted as a team to say that we have struggled and we have suffered and we have endured. But I want to bring to your attention that we want to acknowledge the work and efforts of healthcare workers in low and middle income countries. They are the heroes in every story. They do the hard work. They do the back-breaking work. And we as innovators only try to put tools in their hands to make their work a bit easier, a bit more successful. I have enjoyed immensely working with the team, Dr. Salsawit, aka Salsa, like the dance, medical doctor from Ethiopia, innovator and photographer. Something interesting about Salsa, she cannot, and she has tried several times, she cannot pronounce the name Kichuchiro. Engineer Maureen from Malawi, an innovator, a clinical researcher, and an aspiring Minister for Health and global diplomat. Something about her, she's an incredibly great swimmer. We all can testify of that. Dr. Beritra, the man of many talents, aka Bertrand for non-French speakers, if you don't mind. An innovator, a doctor, a web designer, a programmer. I could go on and on and on. Apparently, he grew up loving chemistry instead of biology, and he ended up being a doctor. And then there is me, the self-proclaimed valedictorian for today. I love an African proverb that says, it takes a village to raise a child. And it has taken a very big village to bring the child of this team this far. And we want to appreciate that we are standing on the shoulders of giants. We have had incredible support from our team at Stanford, and we appreciate them for that. We have had incredible support from our very own East Africa Biodesign team, Professor Rex Wong, Dr. Nathaniel Shimalash, Dr. Gerard, and the one and only Owemba Papa Wemba. We truly appreciate your efforts and support. We also appreciate our partners across the hospitals, the universities, and support from family and friends. And as we mark the end of this journey and the beginning of another, I want to leave you with one or three of the main things we have learned. Number one, that teamwork makes the dream work. And it has taken a lot of hands to make this dream work. Number two, a well-characterized need is the DNA of a good invention. That we have to take time to understand our users' needs. And lastly, every innovation should be a user-centric innovation. And to the team, we're looking forward to the next phase of our journey. Congratulations to you all, and thank you.
Thank you, Basil. Now I have the honor to present the awards to our fellows for their hard work and dedication. I would like to re-invite Professor Phil Cotton to the stage and our Dean of Research and Innovation, Professor Daniel, as well. The inaugural cohort of East Africa Biodesign Fellows is made of 4 individuals, 2 biomedical engineers and 2 physicians, representing 4 different countries from Africa. These are Rwanda, Ethiopia, Kenya, and Malawi. From Ethiopia, we have Dr. Salsoit Yildirim. Salsoit is a force of nature. With her boundless energy and brilliant, sometimes wild ideas, when she's not revolutionizing healthcare, she breaks down professional walls through her unfiltered personality and bold creativity. Salsa? From Rwanda, we have Dr. Bertrand Kwizera. Bertrand is our Rwandan hometown hero. When he's not saving the team from getting lost in Kenya, Rwanda, he's probably tinkering in the prototyping lab or passionately confessing his love for chemistry to someone on the street. Bertrand has been a pillar, always ready to give thoughtful explanations and help give a helping hand. Bertrand. Next, we have Engineer Maureen Valley, our diplomatic powerhouse and the organization queen. Armed with her engineering brilliance and LinkedIn superpowers, Maureen has put this fellowship on the global map better than any PR team can hope for. If you need something done, Maureen is already halfway through it, Maureen. Finally, we have from Kenya, Engineer Basil Masabo, also known as Dr. Mora Mutse. Basil is our calm in the storm and the voice of reason. Basil's stoic presence and discipline brings a zen-like calm to Salsoid's wonderful chaos. He's usually a man of very few words, but every word counts. Basil. Wonderful. Now, please join me in congratulating our inaugural cohort of East Africa Biodesign Fellows as they join a great community of biodesigners. For our keynote speech, I would like to invite Gordon Soul, the Executive Director of Stanford Biodesign, to give his remarks.
Great. Good afternoon, good evening, good morning. I'm Gordon Saul, Executive Director of the Masalam Center for Biodesign program at Stanford University. I'm actually zooming in from Nairobi, Kenya. I'm not in Kigali, unfortunately, which was the original plan. However, at the advice of our partners, due to the Marburg virus, we had to change the travel plans. I'm very happy to hear that the virus outbreak is well contained. Good afternoon, good evening, good morning. All right, just turning down the volume. But I do miss being there in Kigali for this ceremony. But at least I'm on the close same time zone, and I am wearing my UGHE tie for the occasion. So I'm honored to be here to celebrate the first inaugural graduating class of East Africa Biodesign. This program represents the hard work and support of many groups, including our local university partners, UGHE and the University of Rwanda, our partners in Kenya at Kenyatta University, and our local ecosystem partner, Vilgro. Professor Wex Wong and Uwemba, who we've heard about from UGHE, Professors David and Celestine from University of Rwanda have all worked tirelessly to make this program run. I would also like to recognize several people, I think, in the audience for their support, without which this program would not be successful. First, the teaching team, our local faculty, Neil Shimalesh from UGHE, Gerard from University of Rwanda, and our Stanford global faculty, Ritu Kamal and Krista Donaldson, with a special assist from Ross Vinook. And finally, none of this would be possible without the support of the Bill and Melinda Gates Foundation and our program officer, Amy Shelfeffer. When we first began thinking about a biodesign program in East Africa back in early 2022, to be completely honest, it was quite overwhelming. The unknowns included which academic institutions would we partner with, and would they even be interested in hosting this type of innovation training program? What was the local political environment and healthcare system? Was there an appetite to support new healthcare technology developed locally? And finally, who would be our trainees? Would they even be interested in this kind of training? And would they have the necessary technical skills to be successful? To our delight, answers to these unknowns came back resoundingly positive and gave us first the confidence and then the momentum to build the program to where we are now. Foundational to this was UGHE and the University of Rwanda, who embraced the program and gave us the foundational support to move ahead. At Stanford Biodesign, our mission or purpose is to advance health outcomes and health equity. East Africa Biodesign is perfectly aligned with our mission, and though early days, we are quite hopeful for its long-term success. Just to be clear, we at Stanford Biodesign are also students in this undertaking and have much to learn about the development of appropriate medical technologies for the healthcare context as it exists in East Africa. Along with working with our partners to help the EAB program move forward, all of our faculty are also learning important lessons they can take back to our students at Stanford to enable them to innovate to help some of the intractable problems of health equities in our country too. Now I'd like to turn attention to our graduates, Maureen, Basil, Bertrand, and Salsawit, or Salsawitty, I'm not sure which one. It's been an absolute joy to work with each and every one of you. And I know I speak from our entire team at Stanford, how much we appreciate and appreciated your hard work, perseverance, your talents, and your contagious energy. I can hardly imagine a better cohort of fellows to launch our journey in East Africa with. As we have launched biodesign programs really across the globe, we have learned that probably the most important indicator of long-term success of the program is the quality of our trainees, our raw material, in a sense. Well, the raw material we've been privileged to work with in Rwanda, and also having selected our next class of trainees who will start in January in Kenyatta as well, is absolutely phenomenal. My only regret is we aren't able to offer spots to the exceptional candidates that we've had to turn down, but we are working on ways to make the training available to a broader audience. Well, we have seen programs around the world that learning the biodesign process can be very helpful, useful to our graduates' careers, whether that's in business, engineering, medicine, or entrepreneurship. As you might have heard, after graduation, a subset of our fellows have decided to take their project forward to see if they can develop the technology they created through to patient care. We are so excited for them. One of our goals of East Africa Biodesign was for a subset of the graduating fellows to move forward with their projects into development. So this is a very welcome thing. Now, the ecosystem in Rwanda and Kenya and broader sub-Saharan Africa is not particularly well developed to support new companies, and particularly those developing complex regulated medical devices. This is in contrast to Silicon Valley, where Stanford sits, where there are many venture capital firms, domain experts, experienced entrepreneurs. So this will be a tough path for East Africa Biodesign graduates. And I hope you will all keep this in mind as we follow their progress. It is tough, but I and others have confidence that if anyone can do it, this is a group up for the task. And now a message to this year's East Africa Biodesign graduating class. Welcome to the family of biodesign graduates across the world. You have worked hard to get to this point, but now the hard work and fun truly starts as you use your training to make a difference in the world, creating new technologies to help patients. To you, our first class of East Africa Biodesign graduates, please accept our heartfelt congratulations from all of us at Stanford Biodesign. Thank you.
Thank you, Gordon. I would like to now invite our Dean of Research and Innovation, Professor Daniel Seifu, to give us his closing remarks.
Distinguished guests, graduates, colleagues, and ladies and gentlemen, good morning, good afternoon, and good evening. It is my great pleasure to make this closing remark for this remarkable occasion, the graduation of the first cohort of East African Biodesign Fellowship Program at the University of Global Health Equity. Today, we celebrate not only the achievement of our fellows, but also the collaborative spirit that has brought us all together from different parts of the world to advance healthcare innovation in East Africa altogether. This program has been a testament to the power of collaboration. The partnership between University of Global Health Equity, Stanford University, University of Rwanda, and Kenyatta University has created a unique platform for fostering innovation and addressing pressing health challenges in our region. The graduates we honor today represent Kenya, Ethiopia, Rwanda, and Malawi, a true testament to the diversity and unity within the region. These brilliant fellows are now equipped to lead, innovate, and contribute to the transformative solutions in the healthcare. First and foremost, I would like to extend my deepest gratitude to the leadership of UGHE for the unwavering support and vision in establishing and nurturing the groundbreaking fellowship. Your commitments to this fostering health innovation in Africa is deeply inspiring. To Professor Rex, our exceptional center's chair, your leadership, guidance, and expertise has been the cornerstone of this fellowship. Your dedication has paved the way for the success of these graduates and will continue to impact the future of healthcare in the region. Dr. Nathaniel, the head and core faculty of the center, thank you for your tireless effort in ensuring the smooth running of the program and for being a pillar of the support for both faculty and fellows. I would also like to thank the only OEMBA, our diligent administrative program coordinator, for your crucial role you played in keeping everything organized and running efficiently. Our heartfelt thanks go to the Gate Foundation for the generous support, especially Amy Shepflers, and who has made this program possible. Your investment in the healthcare innovation is helping shape the healthier future for the East Africa and beyond. We also deeply appreciate the contributions of our colleagues from Stanford Biodesign, Professor Gordon, Joseph Makawar, Rita Kamal, Krista Donaldson, Megan, Rose, and Mohit. Your expertise, commitment to this collaboration has been invaluable. Your support has also empowered our fellows to take on the challenges of healthcare innovation with confidence and creativity. To our esteemed colleagues from the University of Rwanda, Dr. Celestine, Dr. David, Dr. Gerard, your partnership has strengthened the regional impact of this program. We look forward to continuing these fruitful collaborations. Our partners from Kenya, Dr. Fidelis and June, and Anthony, and Kenneth and Professor Benventure, we are immensely grateful for your contribution to this consortium. We look forward to celebrating your inaugural Kenyatta University East African Biodesign Fellow next year, along with our second cohort. Finally, to our graduates, you are the pioneers of this fellowship, and your achievement making the beginning of an exciting journey. You have shown resilience, creativity, a deep commitment of addressing the unique health challenges faced by our community. The innovation, the solution you have developed during this fellowship will have lasting impact on the healthcare system, not only in your country, but across the continent. As you go forth, know that you carry with you the knowledge, the skills, the network to make meaningful changes. The future of healthcare innovation in East Africa is bright, and we are confident that you will lead the way. We are incredibly proud of you, and we look forward to seeing a remarkable impact you will make. Thank you all for being a part of this journey. Let's continue to innovate and work together toward healthier and more equitable future. Thank you very much.
Thank you, Professor Daniel. I'd like to thank everyone who joined us today to celebrate our fellows, and we will see you next year.